Hey guys, welcome back, episode 25. We're going to continue with our progressions now towards becoming an active stabiliser. We've done the last two videos talking about some transitional floor exercises to teach some of the motor coordination skills required to organise your midsection and your midline stability perfectly to transition to functional movements on their feet. We're going to continue that today, and we're going to talk a little bit about some hollow rock derivatives and how we like to use those with our patient populations and athletes to transition athletes back to being on their feet functionally and effective. So we've done a couple of videos already talking about how to organise the midsection and to increase kind of unilateral peripheral loading with the legs moving and the arms moving. We're going to try and increase peripheral load today and talk about having an organised system so that you can have the best effect when you're doing this exercise. So for this, you're going to need a floor mat. And we're going to get down onto the floor, very much like we have in previous videos. It's important that this is built into the other exercises, so it's not done initially in isolation, it's done as a progression to the last two versions. But we're going to look at organising our midsections like in the previous videos first, and whereas we've been moving individual limbs through range, we're just going to start to adopt some peripheral load. Now, those of you that have followed the video series so far will realise that this is the test itself for identifying whether you are an active or passive stabiliser instinctively. So we're going to get you, first of all, to not go through a full hollow rock, which requires the upper body, arms and legs off the floor. We're going to go for a modified version. So we're just going to go for, at first, the lower leg, double leg lift. Okay, so you're going to organise yourself, ribcage forward, belly button in nice and tight, bum nice and tight, and you're going to accept load and hold. You'll notice I'm still talking to you, I'm still organised, it's not a problem. I'm going to lower down slowly and then disengage everything together. Remember, we are trying to stay away from a big extending pattern where the ribcage flares. This is much more in line with our passive strategies we've seen previously. That's version number one, if you like. If you need to, you can have slightly bent knees doing this one, or as much bend as you feel like you can cope with. What's important though is the height of the feet from the floor doesn't start to get too high up here. That doesn't really challenge this in the way that we want, and is much kind of a regression of even the previous exercise we've done. So ideally we're looking for a 3 or 4 inch lift off the floor, about this kind of height, and you should be able to maintain a patent airway and talk normally and have a conversation if need be. From there, we're going to start to get the upper body organised as well, because what we're talking about here is global flexion, the ability to keep head to toe, fingertips to toe connected together, which will translate into some really good movement patterns later, particularly any pressing overhead and any hanging motions, or any kipping pull-ups or swinging motions on the rings or on the bar is absolutely crucial if you can organise this way. So we're going to just start off by getting the hands in front of the face, one hand on top of the other, and I'm still going to keep my shoulders in an organised position. I'm not going to let them drift up towards the ceiling, because this puts my neck into a horrible position. I'm going to keep my shoulders down, and I'm going to keep my chin packed into my neck nice and tight. In this position, I do exactly the same sequence. My rib cage comes forward, my bum is tight, my tummy is braced, I lift off, and I hold. And I lower down and disengage. I want you to really work on these two simple progressions, because what comes next for us is the engagement of the upper torso, bringing the shoulder girdle forward. And what we're going to talk about is how important it is with regards to head and neck position when we are forming global flexion. This is a massive failure, particularly with our overhead pressing athletes, who go into a very dysfunctional and disengaged lower cervical position with their head jammed out in front of them, trying to get the head in between their arms for the pressing. So we're going to get to that, which is why this is such an important progression. As always, guys, have a go. Let us know what you think. Feedback coming in is fantastic. Glad it's helping so many of you. Give us a ring, let us know. Cheers, guys.